That actually leads perfectly into my next question because the last few years have brought out some concerns, some confusion for a lot of people. Can we trust the system? Is pharma calling the shots? Is insurance companies saying what should happen? In your opinion, give us a state of the union on the current healthcare system.
Yeah, the state of the union of the current healthcare system is that it's a total disaster. It's all about pharmaceuticals, it's all about surgeries, and it's all about money. It is so financially driven that the whole system is totally destroyed. Again, they're great in emergencies, they're great for broken bones, they're great for traumas. If you need open heart surgery, then it's a great place to be. What happened to your father, Brent, where there's an emergency situation again, and there's God bless them for the emergencies. But how do we prevent that? We're not going to prevent that with pharmaceuticals. We're not going to prevent that with tests. We're going to prevent that with eat well, live well, think well, and test, don't guess, and evidence-based supplements and biohacking strategies, what I call the 100-year heart method. That's how we're going to do it. Since the early 1900s, the Rockefeller Institute, the Flexner Report, they basically destroyed the entire holistic medical system. It became pharma-driven. Lipitor is the number one selling drug of all time, hundreds of billions of dollars in revenue, and the drug is a total sham. And then, of course, the last coming up on 4 years right now was just a tragedy on so many different levels. What it did to the economy, what it did now currently with hyperinflation, what it did to families, ultimately what it did to the health of people. We're just starting to scratch the surface on the problems of what happened. And the focus should have always been on how to build the body up naturally, preventive strategies naturally, of which there are many. And I will say that Anthony Fauci is probably the dirtiest medical doctor that's ever lived.
I'd shout amen, but I'm sure that would seem sacrilegious at the moment. Dr. Jack, heart disease has been the number one killer in the US. I have this weird fascination with reports. And so I look at the yearly mortality report that Princeton or Harvard, one of them has one they put out every single year and have forever. And heart disease has been like the number one killer for years and years. Why is it still a threat? That's what I want to know. With modern medicine, right? We're supposedly have the best healthcare system in the world. Why is heart disease always the top of the list?
We don't do anything that addresses cardiovascular disease prevention. We don't talk about the right foods. We don't talk about the right lifestyle. The medical doctors are trained in pharmaceuticals and surgeries. We are where we are, and it's an extremely lucrative business for the Pharma-Hospital-Insurance complex. It's incredible that the hundreds of billions of dollars that are spent in that area of the pharmaceuticals for blood pressure, for cholesterol, the stents and bypass surgeries, the testing that's done, stress tests and ultrasounds and CT scans and MRIs, the pacemakers, defibrillators, like this is mega industry. And the pharma cartel is very powerful. It's not as powerful as the military cartel and certainly not as the banking cartel, but it's up there. And I think that the last 4 years was just pure money grab with just trillions of wasted. Again, it's not like the government printed anything. They just pressed buttons and created currency to give to corporations. And we're going to continue to suffer the consequences. And we are not even near as bad as the situation's going to get. I don't want to be, fatalistic, and I don't want to be, total doomsdayer on this, but I don't think things are going in the right, direction. And the other final thing I'll say about this is that in 2019, in October, there was a gathering in the World Economic Forum along with the Bill and Melinda Gates Foundation, where they talked about a coming pandemic. And this was their pandemic preparedness discussion and gatherings in October of 2019. And then 3 months later, they announced COVID. Now the World Health Organization, in conjunction with the others that I aforementioned, They are talking about disease X, and disease X will be 10 times worse than COVID was. The devil is telling us the script. And if you think that it won't happen, it just happened. It just happened. And it's going to happen again. So you better be prepared for it.